Hello and welcome back to Heart Attack Awareness, where we help you stay informed, stay safe, and protect your most important muscle, your heart. Today's topic is one of the most frequently asked questions I get from viewers and heart attack survivors. What do heart attack survivors wish they knew before their heart attack? The reality is, many people don't realize just how much knowledge and action can change the outcome when it comes to heart disease. So, in today's video, I'm going to share the real stories, mistakes made, and the life-saving lessons that could have made a huge difference. If you're watching this video, it's likely because you want to prevent a heart attack or help someone else who's at risk, and that's a great first step. Let's dive in. Real-life story, John's heart attack. Let's start with John, a 58-year-old accountant who experienced a heart attack while getting out of bed one morning. He felt a pressure on his chest and dismissed it as heartburn. He wasn't experiencing the intense pain he expected a heart attack to bring, so he thought it would go away. Instead of calling 911, he rested and tried to shake it off, thinking it was nothing serious. As the day went on, the pressure turned into mild pain radiating down his left arm. His breathing became shallow, and he felt nauseous. But he still didn't call for help. By the time he reached the hospital hours later, the damage to his heart muscle was significant. John's story is far too common. He later admitted that he wished he knew the real signs of a heart attack, especially how subtle symptoms can be. So let's go over the lessons John learned the hard way and what he and we wish we knew before a heart attack happens. Lesson 1. Listen to your body. John's story teaches us the first and most important lesson. Listen to your body. Sometimes heart attacks don't announce themselves with dramatic chest pain. The symptoms can be very subtle, like mild discomfort, pressure, or fatigue, and they don't always happen in the center of your chest. John's chest pain wasn't intense. It was more of a discomfort that he felt he could ignore. But ignoring these signs can have life-threatening consequences. If you ever feel like something is wrong, especially if the discomfort doesn't go away or gets worse, don't wait. Call 911. Here's why: time is muscle. Every minute without oxygen can damage your heart muscle. The sooner you get medical help, the more muscle tissue can be saved. Lesson 2. Know the warning signs. One thing John wished he knew was how to properly recognize the symptoms of a heart attack. The classic symptom that comes to mind is chest pain, but many people don't realize that shortness of breath, nausea, pain radiating to the left arm, and back or jaw pain are just as important. Here's a breakdown of the common warning signs you should be aware of. Chest pain or pressure. It's often described as a feeling of heaviness, like someone sitting on your chest. Pain in the left arm or both, neck, back, jaw, or stomach. Shortness of breath, even if you're not exerting yourself. Dizziness or lightheadedness. Sweating excessively, especially if it's not related to activity. Nausea or vomiting, which often gets overlooked, especially by women. Extreme fatigue, feeling unusually tired or weak without explanation. If any of these symptoms are occurring together, it could be a heart attack. But it's not always about feeling the classic chest pain, so be alert. Early recognition saves lives. Lesson 3. Don't rely on willpower alone. One of John's biggest regrets was thinking that he could just tough it out or that the discomfort would go away on its own. Don't try to wait it out. Heart attacks are unpredictable, and by the time you realize the severity, it could be too late. Here's a critical point. Call 911 immediately. The faster the response, the more time doctors have to treat the blockage, whether it's through clot-busting drugs, angioplasty, or other interventions. It's important to remember that you cannot wish away a heart attack, and the faster you seek medical attention, the better your chances of minimizing heart damage. The faster the action, the better the outcome. Lesson 4. Aspirin can help, but don't delay medical help. Many heart attack patients take aspirin during a heart attack, but it's not a magic cure. While aspirin can help by thinning the blood and preventing clots from worsening, it's not enough on its own. Here's what John wished he knew. You can't rely on aspirin as your primary action. Calling 911 is the most important step. Aspirin should only be taken after that if recommended by emergency responders. The typical advice is chew 325 milligrams aspirin or 481 milligrams baby aspirins, but always consult with medical professionals first. It's also important to chew the aspirin, as this allows it to enter your bloodstream faster. Lesson 5. Prevention is the best medicine. Finally, and most importantly, prevention is the key. John, like many others, wishes he had been more proactive about his heart health before the heart attack. Here are a few preventive measures you can start right now. Eat a heart-healthy diet. Focus on fresh fruits, vegetables, whole grains, and lean proteins. Limit processed foods, sugar, and sodium. Exercise regularly. A minimum of 150 minutes of moderate exercise per week can reduce your risk. Quit smoking. If you smoke, today is the day to quit. Your heart health improves almost immediately after you stop. Monitor your health. Regular checkups are crucial. Know your blood pressure, cholesterol levels, and blood sugar numbers. Reduce stress. Incorporate relaxation techniques like yoga or mindfulness to lower stress levels. Get enough sleep. 7 to 8 hours of quality sleep is essential for heart health. Real-life success story: Anthony's transformation. Let me tell you about Anthony, a 45-year-old man who turned his health around after a near miss with a heart attack. He was 100 pounds overweight, smoked a pack a day, and had poor eating habits. After a routine checkup, his doctor informed him that his cholesterol was dangerously high, and he was on the verge of a heart attack. That day, Anthony made a decision to change. He started eating cleaner, began walking daily, quit smoking, and joined a support group. Now, 18 months later, he's lost 60 pounds, has normal cholesterol levels, and is happier than ever. Anthony says, "I got a second chance, and I'm not going to waste it. So what do I wish I knew before my heart attack?" It's simple. Listen to your body, learn the signs, and take action immediately. And above all, prevention is the best medicine. If you found this video helpful, like it, subscribe to the channel, and share it with your friends and family, because you never know who might need this information today. Let me know in the comments. What's one thing you learned today that you didn't know before? Or if you've had a heart attack, what's something you wish you knew before it happened? Thank you for watching. Stay safe, stay healthy, and take care of your heart. I'll see you in the next video.